Hi, everyone. My name is Morgan Vaughan. This is LTV. It is Friday, April 17th, 2020, and I am here again with Chrissy Sampson from the East Hampton Star.
Thank you, Morgan.
Thank you for being here. Okay, so let's just get right into it. The local lead.
Okay, so Suffolk County Executive Steve Vaughan, he has announced the creation of a Fiscal Impact Task Force. Now, just for some context there, local governments throughout the U.S. have been hit really hard by the blunt force of the COVID-19 pandemic,
Right.
and Suffolk County is no different. Now, there are some, he said yesterday in his press call that there are some archaic laws in Suffolk County that are making it really hard for the county to provide direct relief to taxpayers.
Oh, okay.
And so one of the ways that they'll be able to bounce back after this is by planning for a recovery.
Okay.
His quote was, "The economic devastation brought on by this pandemic is having a dire impact on state and local governments as tax revenue declines." Now, just a note, he's talking about sales tax.
Okay.
Because we still will have to pay our property taxes.
Okay.
But sales tax, counties are
Because
heavily...
we've stopped buying stuff.
Exactly. Stores are closed. We've stopped buying stuff. He says, as tax revenue declines, municipal budgets that rely on this steady stream of funding will face significant challenges to fund operations. This task force brings together a group of independent financial experts from across the region to examine the full impact. And from what I understand, there's a couple of East End folks represented on that task force.
Okay.
So that's a good sign
That's
for us.
good for us, yeah.
You know, a lot of times the criticism is that, you know, we don't get our fair share of county services. You know, we don't access really the county police
Right.
force. We don't have a lot of the same resources that the county does.
Well, and our issues are so different from the issues of people who live in Brookhaven or Islip. It's just a whole different area almost.
Yeah. I mean, what is uniting us right now, though, is this situation that we're in.
Yep.
Town governments, county governments, you know, everywhere are having this same struggle.
Yeah.
So that is what Suffolk County Executive Steve Vaughan has put together this week just to start that process of recovery. Not turning the economy back on, but how are we going to prepare for the economic blows that are happening?
Right. I think it's really interesting that we're trying to figure out how to sort of like roll into recovery. You know, how things are going to sort of come back piece by piece, maybe, and we'll see. I mean, obviously Cuomo said that we're on pause until May 15th. Other states are, you know, deciding what they're going to do, and it's going to be very interesting to see. I hope that everybody's ready to be patient. Okay, statistics. So I understand that right now in East Hampton we have 113, in Southampton 371. What about the state?
So those across the state, we are at more than 222,300 confirmed positive cases.
Wow.
Hundreds of thousands of cases.
Wow.
We are up over 12,000 fatalities
Wow.
statewide since the
Okay.
beginning of the pandemic. And in Suffolk County, the case total is about 25,500.
And
So-
how many people have we lost?
I'm not sure about the county statistic on that today. I know yesterday it was up almost 700.
I think, yeah. I'm trying to remember.
Up to almost 700.
Yeah.
But the county executive had not had specific information as of his press call at 2:15 today.
Okay, so one of the things that this has, everybody's sort of, and me especially, me anyway, and everybody's sort of beginning to wonder about testing. Cuomo is talking about testing. What is the wisdom about testing and what's going to happen?
So it's still largely not accessible. And this is a problem because in order to move forward, this is what Governor Cuomo was saying this morning at his 11:30 press call. He wants testing to ramp up because that's how we will know who has had it, who has really recovered from it, who has those antibodies, and can return to work, particularly healthcare workers and law enforcement and first responders. Because if you're in contact with folks on a daily basis, you have to know for sure. And, you know, one of the tragedies of this is that so many people are asymptomatic.
I think that's so interesting that was early on. The epidemiologists were saying that this was a big problem with this particular virus, is because people could walk around for so long and be fine just spreading it everywhere. It's actually more dangerous than if it had been a disease that just killed you right off, because it has that spreading capability, which I think is really interesting and unfortunate.
Yeah, so testing, as per Governor Cuomo, is part of the strategy for moving forward now. His executive order today is that private laboratories, like the kind of places that you and I would go for blood work or something like that, that those facilities ramp up testing of COVID-19 patients.
So now, will I be able to go get a test even though I don't have symptoms, or we still have to be symptomatic?
You still have to be symptomatic at this point.
Okay.
But the governor's order today means that there will be a structure developed for that more widespread testing.
Okay.
You know, that's a key. His strategy is test and trace. Test for those who have the virus. Trace your contacts if you have turned up positive, and that's how we will contain it. You know, and the curve this morning of hospitalizations and infections, it's flattening.
Okay.
If you really look at it. And Governor Cuomo's quote this morning, I'll paraphrase here, but he said that this is not a public health official or a government agency that has flattened the curve. It's the people who have flattened the curve by social distancing and staying home.
Right.
So he said, this is on us, America. You know, we have flattened the curve, or are on their way to flatten the curve, he says this morning.
Well, I hope that people take that to heart and we continue to do that. I'm going to talk to Peter Van Scoyoc in a second, and he talks about that a little bit too, about the importance that we're all playing in taking care of this. Is there anything else that you have today?
I don't have anything, but I thought you had a good news headline.
Oh, yeah, I do have a good news headline.
East Hampton Town.
East Hampton Town. The Human Services has served over 2,500 frozen meals for seniors. So East Hampton Town has, and we have the number going across on the crawl all the time. This is where you call if you need help getting groceries, getting pharmacy, etc. But also, they've been serving the meals. So this is a fantastic thing that they're doing.
Is it 2,500 per week or
No, since it started.
Okay.
So yeah, I assume I didn't. Yeah. No, it was which was a month ago.
Okay.
Yeah. So since the outbreak, which is a lot, because that requires a lot of people, etc. Anything else for this lovely weekend? What is a weekend?
The days are kind of blurring together at this point, but I just want to say thank you for having me on the show.
Chrissy Sampson came in the clutch and has been a fantastic, unbelievable person to help me get the information to you the past couple weeks, or 3 weeks now. 3 weeks, and I can't thank her enough. She has been phenomenal, and she will maybe be back next week one day, but we might have another guest next week because she's too important just to stick around with me every day, and I appreciate it so much. Okay, so next is I'm talking with Peter Van Scoyoc. There apparently is a tiny bit of glitch with the sound at the very beginning, but it does clear up, and it's literally, I think, maybe the first half minute or so, but it will be fine, and that will be next right away on Facts at 5. Thank you again, Chrissy Sampson, and stay home, stay safe. Here today, Friday, April 17th, with Peter Van Scoyoc. Hi, Peter.
Hi, Morgan. Nice to see you.
Nice to see you, too. Peter, of course, is the supervisor of the town of East Hampton, and we really appreciate you being here today and filling us in on, the goings-on about, which I know that you just were saying it is all COVID all the time, and it is an immense undertaking to take care of all these people in this town. What do you think so far about the town's response in terms of COVID-19, in terms of the state, in terms of the health of everyone? I know that's a very broad question, but...
It is. I feel pretty good about it. I mean, there's obviously more that we need to keep doing, and it's a rapidly changing, high flux situation, very fluid.
How do you deal with that? I was going to ask you how you deal with that rapidly changing, fluid situation.
Well, as I said before the meeting, it's hashtag all COVID all the time. It's really required every waking hour of myself and my executive staff and our Unified Incident Command, which includes myself, Chief Sarlo, and Bruce Bates, our Emergency Preparedness Coordinator. The first 2 or 3 weeks were really all hands on deck in terms of trying to chase down every potential way that we could help protect the public. I think some of the early decisions that I made with regard to closing the senior center and the congregate senior programs within the town facilities, including the YMCA Rec Center, have led to the lowest rate of infection on Long Island. Part of that is just naturally due to our low density. People aren't forced into close contact on a regular basis as much here as elsewhere. But we've also had a number of second homeowners and people come out to escape the density of the city and elsewhere.
Right.
Use their second homes during this time when everybody's supposed to be indoors. And I think the response of the community overall has been very much attuned to trying to social distance, to adapt to the changing recommendations. One of the recommendations that came out, I believe it was April 3rd, by the CDC was that they reversed their position on face coverings and face masks.
Right.
And we're recommending that people start using them. So we immediately started talking about that with the public, that if they're going to be out in public, they're going to the grocery stores or whatever, that they should wear face coverings. That's now made its way to an executive order from the governor, which went into effect, I believe, at 8 p.m. last night. Today, we posted signs out on the roadways in front of Town Hall, basically reminding everybody that if they're out in public and cannot stay more than 6 feet away from others, that they are required to be wearing face coverings. We're getting the word out at the recycle center. If you're coming there to drop off refuse, last week I ordered that every other space be blocked off so that we could have people not parking so close to each other. But now with the new guidance over face coverings, we're asking people to wear face coverings in that setting always, and you will be turned away if you're not wearing a face covering in that setting, because it's pretty much impossible, I think, to keep people more than 6 feet away entering into that corridor and through those openings in the
Right.
At the what's known as the wall,
Right.
where all the dumpsters are.
What happened?
So we're getting that word out.
What about with the you had a call out for donations of masks and gloves. How did that go, and how is that going?
So we have been receiving donations, and we appreciate the generosity of the community. As you can make your own mask, and there are a number of videos, including one by the Surgeon General, how to make one very quickly and easily. These are fine for general use by the public going out, and you should be wearing those when you're out in public. Some of the essential workers that are at the front lines and are really doing heroic measures to keep society functioning, provide essentials such as prescriptions at pharmacies and grocery stores, particularly. Those folks are in relatively close contact with the general public on a daily basis. We had reached out to every food retailer in the town, I think nearly a month ago now, basically reiterating the idea that extra measures had to be taken for safety. We've made updates of that recommendation to stores. Many of the stores have already started implementing things such as one-way aisles, limiting the number of people in the store at a time, requiring face coverings, and this is sort of like the new normal now. So our outreach was to help get additional supplies for those first-line workers. Currently, we have PPEs, as everybody knows what a PPE is now.
Right.
It's basically masks, gloves, gowns. Yeah, so that acronym everybody is aware of now. But so town workers, town essential workers, the police, first responders, first-line medical workers, those N95 masks are being reserved for those purposes. but ear loop masks and other face coverings that can be made to help supplement the supplies that retailers are required to now provide their employees is something that we felt was necessary to try and do at this point. So we've gotten hundreds of gloves and face masks at this point, and we're reaching out to those essential retailers, primarily grocers and pharmacies, to make sure they have enough. And because those are obviously businesses that are providing truly essential items.
Right.
Some of the other businesses deemed essential, maybe don't come in as close contact with others. For instance, landscaping companies are still deemed to be essential at this point. Something I personally question, but there are other essential businesses that have become non-essential, like all construction is now not essential as it originally
Right.
was. We had concerns over the huge amount of people riding together in vehicles coming east every day and west every afternoon. So it was great to have the governor respond quickly and effectively to our call here to limit that further. I'd also requested that consideration be given to consider pool companies essential at this point, because as we enter the warmer season, if you have an unopened pool, it's basically a mosquito breeding ground. And if you think of the number of pools everywhere, we have equine encephalitis, West Nile virus, and Zika virus are all possible here. And so to make pool openings essential, and their maintenance was already considered essential because it deals with basic sanitation of a residence. So those things are constantly in flux, and we're adapting as quickly as we can to getting the word out when something like that changes. Currently, like marinas are considered non-essential, recreational boating non-essential. However, we're getting the word out that commercial fishing is considered essential, and all marine services, boat yards, relative to supporting the commercial fishing industry are in fact essential, and we obviously want those to continue. I know that Assemblyman Fred Thiel today, along with Senator Ken LaValle, have requested of Secretary Wilbur that further considerations be given to aiding the commercial and recreational charter businesses to make sure that they get the kind of support and funding as part of this stimulus and payment protection legislation going forward. Obviously, they're large businesses in our town, and with the largest commercial fishing fleet in New York State being in Montauk. I'm really encouraged by the number of residents who step forward either to volunteer their time in helping out with food pantries or delivery of food to shut-ins, and just wanting to reach out and help their fellow residents. It's really remarkable, and it's so encouraging to see. I know when I see so many people doing this and the donations coming in to many of our charitable organizations, that we are going to be okay. It's going to be a rough patch for a while, and we just need to really be cognizant of those who are in need to try and help them through this very difficult period. We need to help alleviate each other's anxiety and stress and lend a helping hand. So that's really what we're primarily focused on, getting through the health crisis and the immediate economic impacts. Many of our residents work paycheck to paycheck. We need to help them through this time. There are a lot of resources within the community, and again, I've been heartened to have individuals come forward saying I can make significant contributions. Help me direct where that should go.
Right.
So again, to everyone who's pitching in, it really is all hands on deck. We need to come together as a community. We need to not try to cast blame or scapegoat others for wanting to try and stay safe and locating maybe to their second home in order to do that. But again, we're also stepping up enforcement so that we can get compliance with these rules and regulations. I've authorized additional overtime for our enforcement agencies in order to make sure that people are social distancing. And at this point, our primary goal is to gain compliance, to educate and gain compliance. And really, we've been very successful with that. But that's an ongoing thing. Obviously, as the weather gets warmer, more people will want to get outside. So we'll have to be constantly adjusting. And, we seem to have hit a plateau. I don't know if this is the peak, but right now we've hit a plateau. The plateau, unfortunately, is something like 1,600 new hospitalizations within the county daily, and 40 to 45 deaths daily, which is just hard to comprehend. But when you chart the progress of this in terms of number of cases, it seems to have sort of leveled off, but at an unacceptably high level. And we're really going to have to keep at this in order to get those levels of infection down.
What do you
getting
think
through
about
the public health crisis? Go ahead.
No, that's what I was going to ask you. I was going to ask you in terms of.
I think getting through the public health crisis is goal number one. And then hot on the heels of that is the economic issues that we need to address. But first of all, you have to get people through that. They have to be healthy. They have to be safe. That will make our economy come back much stronger, much quicker. I think there is a real concern about becoming too liberal and unrestrictive too soon and seeing the disease, because it is so virulent and so easily spread, quickly spike back up. The quote second wave is of great concern. So in order to really effectively address that, what we really need is widespread testing. I think pretty much all the scientists and healthcare professionals who deal with this sort of pandemic scenario are all saying the same thing. Without widespread testing and the ability to isolate and track the spread of the disease, then you can't really know in real time and effectively where the disease is and how it's spreading. Right now, we only have, I think, 3 sites within Suffolk County for testing. The closest is in Riverhead, and then there's Stony Brook, and I believe there's a drive-through in Huntington as well. There is still a shortage of testing. The ability to, I think it's something like 1,600 tests a day are able to be given within the county. Obviously, there's hundreds of thousands of people living here. The percentage of people within the county already tested is pretty low. I think, it's 57,000 as of yesterday have been tested, and there was a 42.7% rate of infection among those who were tested.
That's still, I always wonder about that, though, because that's still people who are sick. So it's so, people who are presenting with problems. So my question is, do you think before the pause, because now Governor Cuomo's extended pause to May 15th, which I assume that you think is a good idea, but will we see significant testing before that, do you think?
I have no idea. I know that it's been continually ramped up. From the very first days, there was very little testing available.
Right.
And there are other very significant issues surrounding testing, and if we're only testing those who feel sick, then we're going to miss maybe 20% of those who are actually carrying and spreading the disease. I read an article about the Diamond Princess cruise ship, which was, quarantined, I think it was in Japan, and something like 18% of the passengers on that ship tested positive yet displayed no symptoms. So they were asymptomatic and contagious for the period that they had the disease. Right. So, you could be feeling fine walking around in public, and, you could be infecting people. You could be infecting folks.
Everybody
And
you meet.
so, yeah, I mean,
Everything you
it's an
touch.
incredibly
It's amazing.
insidious. That's why, at this point, our very best way to address this disease is to, continually being hyper focused on hygiene, washing your hands, trying not to touch your face as much as possible, wearing a face covering in public. Don't go out in public unless you absolutely really need to. And by that I mean, don't go out and just walk the streets in the village or whatever.
Right.
It's good to get out and get some fresh air. So find a place where nobody else is around. There are plenty of opportunities to do that here in our town. We have lots of parkland spread out. Be careful when you go to the beach road ends. I know, that's a popular spot for people to go and
Right.
walk. And for the most part, there really are no issues. I think it's also important for residents to understand that you don't really need to be socially distancing from members of your own household. So if you have a family of 4 or 6 and they're out walking together with their dog on the beach, that's not a social distancing concern. It's when people of differing households and unrelated are in closer contact and gathering that we worry about the spread of the disease. Chances are those folks within the same household, if they're socially distancing from the outside world and staying together, that they'll all stay safe and healthy.
So we have just like another second or so. Is there any other thing that we as residents can do that would be helpful to the town, or that you think, as the representative, our representative for the town, is the most important thing to take away from this experience so far?
Well, there are a couple of things. First of all, I would encourage everyone to visit the town's website, which is ehamptony.gov, and look, like us on Facebook. The number of the increase in page likes is at 603% just in the last, 3 weeks, 4 weeks. In the last month, we've had a 600% increase. Page likes, our previews are up 1,488%. We've reached over almost 20,000 people in that period of time. That's up 635%. So, our outreach to the public has been on a daily basis. We're posting constantly on Facebook and on the website. Again, that is ehamptony.gov. You'll see at the top banner, there's information on there, whether it be small business loans, economic recovery programs, health advice, the latest guidance on what are essential businesses. This is in constant flux and being updated. So I encourage everyone to stay connected to us in that way, stay informed, and please keep yourself and your family safe and healthy at this time.
All right, excellent. Thank you so much, Peter. And by the way, the website will be on at the end on the slates, and we put it up every day. It's an excellent resource, especially the press releases. So thank you very much. And most of them are in Spanish, I think, as well.
Yes, we have them in English and in Spanish, and I think we were the first community on Long Island to really do that,
which is fantastic.
In terms of
Thank you.
Outreach. So we're excited about the engagement with the public. We encourage you to do so. And I also just want to give a quick shout out to all of our town workers and staff members who've been working through this and keeping the wheels of government turning at this time, which is difficult, as I'm sure you know. My heart goes out to those who have lost loved ones, who are sick, who are out of work. And I would just say, we're thinking of all of you, and we'll get through this together.
We will. Thank you, Peter. Thank you very much.
Thank you, Morgan. Be well. Nice to see you.